Good evening. If you could take your seats, please. Good evening. Welcome to New Orleans. Welcome to the annual meeting of the American Society of Tropical Medicine and Hygiene. My name is Dan Bausch. I'm the Scientific Program Chair for the Society. We're really happy to see you here. Thanks so much for coming to New Orleans. I'm going to go just through a few of the highlights of the meeting before we move on with the program with a great speaker tonight and Dr. Moeti. The first highlight that I wanted to bring out was just that you're all here. We'll have about almost 5,000 people from across the world of more than 100 different countries, and I want to especially welcome the people who have come from other countries overseas. We know how hard it is, and it takes a lot of energy and cost and logistics to come to the United States for a meeting like this, so we really appreciate you being here and welcome your presence. This is the 100th year anniversary of the 1918 flu, and so we thought it was appropriate this year to emphasize outbreaks and flu in our program, and so you'll see throughout the program a lot of different things related to outbreaks, so a lot of Ebola sessions and a lot of flu sessions, and we'll start off tomorrow morning with a really great session entitled Tackling Outbreaks, in which some of the leaders in outbreak response will talk about how to navigate these complex entities. And so please join us for those. But if outbreaks are not your thing, there's everything else still. We have all the malaria, all the neglected tropical diseases. You know, name your particular thing in entomology or virology or whatever it is. I'm sure you'll find it here. The one unfortunate thing that I was going to highlight, we had a novel thing this year with the Preston brothers, two authors, Doug and Richard Preston, in a session that we entitled Tropical Bookshelf, and unfortunately, due to an illness in the family, the brothers have had to cancel their attendance. So we wish them well with that and hope to perhaps put them into the program next year. You may notice that we have these beautiful banners from the Smithsonian Institution, and so these are derived from a great exhibition at the Smithsonian, the Natural History Museum there in Washington, D.C., which I definitely recommend going to visit if you have a chance. We have just little parts of that, but you'll see them throughout the hotels, both hotels here in the Marriott and across the street at the Sheraton. And we're fortunate to have Dr. Sabrina Sholts, who is the lead curator for this exhibit, with us tonight to give a few words about the exhibit. So I'll turn the microphone over to her. Thank you, Sabrina.
Thank you, Dan. Thank you, everyone. Thank you, ASTMH. It is such an honor and a pleasure to be here and part of this event. The Outbreak Exhibit started with an idea from an infectious disease physician named Dan Lucy, who maybe some of you know and who's here tonight, when he was treating Ebola patients in West Africa in 2014. At that time, the public was not getting a lot of information about zoonotic diseases and how they can emerge and spread anywhere on our human-dominated planet. 4 years later, with the help of many organizations that are part of this conference, and some of whom are listed on this panel behind me, Outbreak is doing just that. We are educating the public about zoonotic diseases, pandemic risks, and the interconnectedness of human, animal, and environmental health. And we are doing this on a global scale. You see here, this is the Outbreak Exhibit in our museum. Well, we've made another version of it that we wanted to be used by communities everywhere in the world to address local health needs. It is called Outbreak DIY. And it is essentially a free public health toolkit. It includes electronic files for panels like those that you see displayed around me and you see around the conference in the next few days, customizable templates, videos, interactive games and maps, training materials for volunteers, a style and a resource guide with information and tips. We offer all of these materials in English, and we've translated a lot of them also into French, Spanish, Arabic, and traditional and simplified Chinese. Since we launched Outbreak DIY 5 months ago, we've had over 100 requests for these materials, and dozens of requesters have already done Outbreak themselves by customizing panels and doing additional translations of content into Finnish, Swedish, Thai, and Khmer. Outbreak DIY is new for the Smithsonian. It is an experiment that is revealing the endless ways and places that community engagement in public health education can happen. On social media, we are sharing photos of Outbreak DIY as it is used all over the world in hospitals and libraries and universities and museums and conferences. And please contact us if you or someone you know might want to use Outbreak DIY as well. It's never been more important for scientists to get involved in communicating about their work, and I think in this connected world, we've never been in a better position to do so. So congrats to all the winners tonight, and have a great conference, everyone. Thank you.
Great, thank you so much, Sabrina. It's really great for us to be able to partner with you in the Smithsonian. So we hope this is the first of many to come on that score. As you can imagine, a meeting like this does not come off easily. There's a lot of logistical preparation, and so I want to thank the many, many people, too many to name, but the ASTMH staff, Burness Communications, many others who make something like this happen. We have a series of program committees that take your abstracts and symposia and funnel through that and bring it to really present, we think, some of the highest quality science in the world, and I want to thank them for those efforts. We also have a number of sponsors and supporters and donors to thank, and I will name them because it's extremely important for our society. So Bill and Melinda Gates Foundation, Takeda Pharmaceuticals International, Novartis Social Business, the Celgene Corporation, Tech Lab Incorporated, the Indiana University Ryan White Center for Pediatric Infections and Global Health, BEI Resources, Sanofi Pasteur, Wellcome Trust, PLOS, and Elsevier are our sponsors. Our supporters are Burroughs Wellcome Fund, the Thermosurgery Incorporated, International Association for Medical Assistance to Travelers, and Vulcan Incorporated, and last but not least, our donors, Dr. Annie Petrie and the late William A. Petrie Sr., the Petrie family, Michael Gottlieb, Thomas C. Green Jr., and Joel Moss. Thank you very much for your support to the Society. Also, don't forget to visit the exhibit hall. Lots of services and the latest things there on display, and so that's also a part of the meeting not to be missed. I'll finish now in just a minute, but two last words. Don't forget, of course, after the program tonight, that we have the opening reception across the way in the Sheraton. That's in the Napoleon Ballroom on the 3rd floor. And we'll have a little bit of New Orleans flair to lead you there, and you'll see what I mean in an hour and a half or so. And now I'm happy to give the microphone over to ASTMH President Regina Rabinovich. Thank you very much, and welcome.
Welcome to New Orleans. Thank you, Dan. I want to thank you as well under your leadership and with Associate Chair Stephanie Yano and the hard work of all of the members of that committee, which is actually quite a large one, and it's what it takes. We have an outstanding scientific program this year. The Society would be unable to do this without the efforts of the entire committee, so thank you very much. Welcome to everyone to the American Society of Tropical Medicine and Hygiene's 2018 annual meeting. The last year has gone really, really quickly. And what a year it has been for our society, for tropical medicine and hygiene, and for global health in general. The political climate in the US and globally remains challenging, and we continue to face funding threats to the health and welfare of our world. And I can assure you that the society remains deeply engaged, not only through your work to create innovative solutions and to advance them in the field, but also in advocacy to have groups that are critical to important decisions recognize the issues that need to be considered in making decisions. Among other outbreaks, we also faced another Ebola outbreak in Africa, this time in the Democratic Republic of Congo. And there were two things I was aware of as the days for TropMed were approaching. The first was watching this one evolve and wondering how would it affect not only the communities at risk, but the society meeting, because I remembered the last time that we were here, it was a huge issue, which almost led to the cancellation of the meeting and the struggles with how to handle it and how to make decisions that encompass both public health and the health of everyone at the meeting. And the other one was watching a hurricane get closer and closer to New Orleans. And although I've lived in North Carolina and I'm familiar with how one prepares for these, the ones that we have faced this year have been rather devastating. So on the good news side, there's other things that have happened, and let me just comment on a couple of them. In June, the FDA approved the new drug Crintafil, I call it tafenoquine, which can prevent the relapse of Plasmodium vivax malaria with a single dose, and this is something we've been waiting for a while, so that was really good news. And then in September, the FDA added 4 tropical diseases to its priority review voucher program, covering Lassa fever, chikungunya, rabies, and cryptococcal meningitis. And these additions can help facilitate industry engagement in creating new products for solutions to these diseases. And we actually need more of these kinds of interventions that, along with funding and along with really good science, can actually result in ability to cure or prevent diseases. I was also aware, and we spoke about it last month, the United Nations held its first high-level meeting on TB. That was actually pretty amazing to realize that there had never been one held that had high-level participation of countries. The meeting took place at the same time that preliminary but encouraging results were released from the phase 2b clinical trial of the M72 B clinical SO1E tuberculosis vaccine candidate that resulted from a partnership, from a public-private partnership between ARIS and GlaxoSmithKline. So it was a really important step forward because we've seen a lot of trial results, but have not seen positive results, although not perfect, and very encouraging for the field of tuberculosis, which causes an important burden on global health. There are also opportunities available in the coming year despite the complex political situation here and in other countries. And one opportunity for the U.S. is commitment to the U.S. Global Fund, for the U.S. to make commitments to the Global Fund for AIDS, TB, and Malaria, which is having its replenishment in March of 2019. And that matters to us. It matters to us because it impacts on malaria, because TB is important, because the 3 diseases together require constant pressure, or we will see resurgences, and hopefully not epidemics. Now, on the other hand, this week, I heard 5,000 today, and I thought we were at 4,700, but we'll see what the final count is. I think that makes it the largest meeting that we've ever had. And you come from more than 100 countries. Pre-registrations shows that 40% of registered attendees are from outside of the US. And this has been a certain trend for the society. Deeper, and we've made things possible through some adjustments with fees, et cetera, through travel awards and through engagement of everybody in the scientific program. But there are 2 people I would like to call out. That's thrilled to meet one of them earlier, and I know that they're both here. The first is His Excellency, the Ambassador of the Republic of Mali, who's come to the United States, Mohamedou Nimaiga. Welcome, I can't see you right now, but there you are. Welcome to New Orleans, Ambassador. We're very glad that you joined us, and Jim D, I don't know how you did that, but that's just great to have you here. The other is His Excellency, the Vice Minister of Health and Social Welfare for the Government of Equatorial Guinea, Mitwa Ondo Ayekaba. Welcome to you also, Your Excellency. And I'm not sure that I can see you. There you are. Thank you. You may recall the article that Phil Rosenthal and the committee wrote on the international ASTMH. We are the American Society, but it's really at this point that you can see not only engagement of our international members, but your participation that makes this what we are today. And both TropMed, global health communities, all of this is what gives us our strength and our ability to move us towards our ultimate goal, a world free from tropical infectious diseases. Now, I'm very fortunate and pleased to be able to introduce our keynote speaker, Dr. Matshidiso Moeti. Dr. Moeti is the WHO Regional Director for Africa, the first woman WHO Regional Director for Africa. We're proud of that. And it's great that she's a woman, but she's doing some quite interesting things, leading health transformation in the African region through an agenda that is building a responsive, effective, and results-driven regional secretariat. And we were speaking earlier about how one handles that and priorities in the complex. We have enough difficulty in one country when you're dealing with a region that has multiple countries and cultures and the diversity that you have to handle. And it was an interesting set of responses. She's focused on advancing towards universal health coverage, accelerating progress toward global development goals, and, of course, tackling emerging threats. Strong partnerships are underpinning every aspect of the regional office's work during her tenure. She is also a public health veteran with more than 35 years of national and international experience on the front line of the transformation that is undergoing in Africa. She joined the WHO Regional Office in 1999 and has held several senior positions in the organization, including Deputy Regional Director, Director of Non-Communicable Diseases, and WHO Representative to Malawi. So she's gone through the system. Under her leadership, the Regional Committee for Africa in 2016 adopted the framework for implementing the Global Technical Strategy for Malaria, 2016 to 2030, in the African region. Will you please join me in welcoming Matshidiso Moeti, Dr. Moeti.
Dr. Rabinovich and the leadership of the American Society for Tropical Medicine and Hygiene, distinguished participants, ladies, gentlemen, and colleagues, it's a great honor for me to have been invited to your 67th annual meeting and to be invited to speak to you about, I was told, pretty much whatever occurred to me, it might be interesting to talk to you about. So that's a great deal of freedom. Very often my colleagues give me speeches to read. It's like, go and say this, go and read that. So this was really a privilege to sit back and have the opportunity to think, what do I want to talk to these scientists, researchers, and actors in tropical medicine and global health about? First, it's an opportunity not only for me, but also for WHO in Africa, for all my colleagues in the African region, because we have here, and congratulations for having a meeting that reached this number, we have here scientists and experts who are very interested in working to improve health in the African region. I think many of your members from different disciplines, areas of interest, working in different countries, are collectively working to contribute to improving the lives, health, well-being of African people, which is my responsibility as the leader of WHO in the African region together with my team. So I believe my being here, and we spoke about that earlier, offers opportunities to explore how the work that WHO does could interface with what all of you do in African countries in order to support the countries, the governments, to do what they can to improve health. So I'm very excited that at the same time we have a deputy minister from Guinea-Bissau, we have the ambassador from Mali, because they play a strong role in guiding and contributing to the policies, the programs, ultimately the services that their governments working with all of you and working with the international community are going to put in place to improve the health of the people. So it's a great opportunity. Okay, I need to know where to push here. Okay. Oh, it's here. Okay, we missed to have a briefing and a rehearsal. So I'm not quite sure. Ah, there we are. No, no. I need to go back. Right. So I thought that faced with a room full of scientists, I didn't realize there'd be 5,000 of you. There's not much point in my trying to delve into what you know even better than I do. But to try and situate this discussion in what is currently going on in global health in the African region, the work that's ongoing on the Sustainable Development Goals, and the need that's been well recognized by national leaders and the international community for this, all of the work that you do, the research, the knowledge, the science, the new technologies, the new products, to be delivered ultimately through functioning national health systems in the countries. And there, as we like to say, to make sure that these services leave no one behind. So reach everybody. And having been in my youth and continuing to be an activist for women's rights, for equity among women, I thought with such a strong equity focus in the discussion around the Sustainable Development Goals, there is need for us to continue to explore and to make sure that the inequities that bedevil women's lives every day need to be addressed as part of what we all do in global health. And we need to do better than we did in the MDG era to make progress and to succeed. So I've just come from Kazakhstan. I've had a very extraordinary trip. So the time zone, I think it's about 11 hours ahead of here. So I flew from Astana yesterday, where we were celebrating 40 years of Alma-Ata primary health care, and that determination to provide health for all that was made so many years ago. And there were many discussions there about equity, not only working in a systemic way to make sure that all the science, innovation is translated into action and services that reach people, but making sure that nobody is left behind and doing better than we did in the MDG era to address not only issues of equity in the systems, but to look at particular groups, population subgroups, whether they be vulnerable people in relation to one problem or one disease, or other groups that need particular attention to be made in order for them to be among those who have access to services, who are able to express their demand for services effectively to improve their health and well-being. So how does this affect women, and why do I consider that women are so important in relation to this question? First of all, we know that, well, in Africa, that is, women constitute just over half of the population, so they're a group that matters in one way or the other. We also do know that women play an extremely important role in providing health care in the public health systems, in the formal health systems, and very much at home, at the community level, something that ensures, that places them at higher risk of some diseases, as we will see as I carry on with this discussion, but something that holds out huge potential for their contribution, not only to public health, to health development in countries, but to socioeconomic development in their countries as well. This is, I know it's been decades since this has been discussed, but it's my view that this is still very much a work in progress. And we need to remind ourselves and to review how we are progressing with exploiting and leveraging all the potential and capacities that women have to contribute to health, while also insisting on ensuring that as beneficiaries of health systems, they have access and can make their demand in an equitable way to the health systems for prevention and care, treatment, and rehabilitation that they need for their own health, because they're such a powerful contribution to health development and, as I said, to socioeconomic development in Africa. So we also know that although women are so represented in the healthcare systems in countries, they do tend to be under-rewarded, also partly because they tend to they don't occupy the highest positions of leadership, which is again another loss, because with women's voice being heard in policymaking in countries, I believe strongly that we can have better outcomes in health in the region. I won't say much about the underpaid role of women as caregivers in the home. This is a phenomenon not only in African countries, but also in Western countries, in all countries, in fact. And it's something that is a challenge in societies, but needs to be recognized, and we need more effective strategies to deal with this. When I was doing my master's in public health, which is many years ago now, at the London School of Hygiene and Tropical Medicine, I remember writing an essay as part of the coursework which touched on this. And honestly, I don't believe that we've made all that much progress in adequately, fairly, justly rewarding women for the contribution that they make in health. And of course, we know if we address the socioeconomic determinants of health, we will work on areas like education, empowerment of women, representation of women in decision-making positions. That'll help to contribute, that'll help to unleash the potential economically of all these women to contribute to economic development in countries. I believe some clever economists have quantified what the lost opportunity if we're not making progress in this sense. So what is the situation of women's health in the African region? I won't dwell very long on this, but simply to say that when we talk about women's health in Africa, very often we zero in immediately on their sexual and reproductive role and health, and these are health problems that are of great importance. We know that in the era of the Millennium Development Goals, we did make a lot of progress in improving health in Africa. Child mortality reduced significantly, maternal deaths reduced somewhat, not to the extent that had been anticipated, and this has something to do with the status and very much the quality of health services that are available in African countries. There was a reduction in the mortality from malaria, from HIV, AIDS, and we see here a graph showing how maternal mortality, so maternal deaths per 100,000 live births reduced in African countries. But we also note the difference between what's happening in Africa and what's happening in the rest of the world, including in Southeast Asia. So these rates in the African region are very much higher. And if we look within African countries, within the African region, we see quite significant differences as well between countries like Niger, Chad, and others, perhaps like Namibia and the Seychelles. And this is directly related to determinants of health that are structurally determined, socially determined, which we need to address, including, I believe, in the work that you are doing in tropical health, in communicable diseases, if we're going to make the progress that we need to make to improve the health of women. So here, for example, we know that women's access to family planning services are not where they should be. There continue to be huge gaps, and this is particularly the case for adolescent women who tend to have higher rates of maternal mortality when they do give birth, if they do fall pregnant. And some of what determines this is women's economic status, their income, women's decision-making authority within the home, which is determined by many things, by their level of education, by the resources that they have, and by the social structure in which they are living their lives. We talk a lot, and if you look at the literature and some of the strategies around the Sustainable Development Goals, there is great emphasis on what is called multi-sectoral action, or health in all policies, or addressing the determinants of health. And it will require us to work in very different ways from what we do currently, and just emerging from work that was done on HIV/AIDS, malaria. I recall saying to a good friend who is the leader of UNAIDS that my expectation was that in addition to emphasizing access to treatment, the elimination of prevention of mother-to-child transmission of HIV, I was expecting us to do much more work on prevention, which requires interventions that go way beyond what happens in the health sector, in the health system, and really deals with some fundamentals of equity, power differences, gender relations, gender equity differentials between men and women in order to really enable prevention to take place. And this is very relevant for what is the situation as far as HIV is concerned. So this slide just shows the differences in prevalence, in new infections between men and women in the African region. And for the reasons that I've stated, gender inequities, women's inability to avoid, based on their socioeconomic status, having risky sexual relations with men, we see that very dramatically. If you look at the information about the youngest women who get infected, we have more than twice the number of new infections of HIV among 15 to 24-year-old women than we do among males. This is a direct consequence of the difference in terms of access to preventive services and the authority and power to say no when a young girl does not want to have either forced or coerced sex or sexual relations simply out of economic necessity, which is still a reality for many women today. But women don't only have illness related to their sexual and reproductive lives. And here again, to show that as far as neglected tropical diseases are concerned, at least in the case of trachoma, partly related to their role in society, the work that women do, looking after children, being at home, in environments where we don't have access to safe water, sanitation, hygiene practices, and looking after babies and children. Women are more vulnerable to trachoma infection than are men. And women's vulnerability to genital schistosomiasis also drives their vulnerability to HIV transmission. So these are areas, I believe, that need to be addressed not only with a purely scientific lens, but we need, as we are putting programs in place, to consider the gender-related, the social determinants that drive vulnerability, and work on interventions that address these directly. I believe this is the difference that we're going to have to make as we work on these so-called health in all policies and on the social determinants of health to drive better equity. It's very often forgotten that women are also affected by the newly emerging epidemic of non-communicable or chronic diseases in Africa, as well as in other places as well. And there's data that gives great concern in the trends that we are seeing in not only prevalence and mortality, but also the risk factors that drive the non-communicable diseases, as is shown in this slide. So we have, at any moment in time, about 500,000 women with cervical cancer, out of whom 300,000 plus die every year. And this is more women than die giving birth to children. So if we look at the attention that goes to maternal mortality, we see that we really need to be working on addressing some of the risk factors that drive this And this, for example, is related to low coverage of cervical screening services at the primary care level in most countries. If we look at the priorities that are articulated in the national health policies and national health strategies in many African countries, somewhere we will find non-communicable diseases. And then if we look at the budgetary allocation, how those priorities translate into resources and programs to address these newly emerging areas, we find that there's a huge amount of work to do in terms of advocacy, policy making that is based on evidence, and providing the services that are needed. And the risk factors are equally important in the emergence of non-communicable diseases, including what some people call the commercial determinants of health. So we've talked a lot in WHO about the social and economic determinants. We know that some of the drivers of these risk factors are directly related to the marketing of tobacco, marketing of alcohol, marketing of unhealthy foods, and of course, as far as women are concerned, very much the lack of opportunities and spaces to live more active lives, to exercise. I remember when I was a young doctor and I went back home from my training, I used to jog with a friend. This was in Botswana, in Gaborone, more than 30 years ago. And honestly, we were jogging on the roadside, and one of the strongest reactions that we used to stimulate was among young men, our age groups, who used to mock us. Well, where are you running? What's going on with you? So the idea of women wearing perhaps not very modest clothing and running along the roadside at that time in Gaborone was not acceptable. This has changed, but I think if you go to many cities and try to find where a low-income woman who can't pay the fees for a gym is going to be able to exercise, you'll find it's very difficult to find safe spaces, safe in terms of road traffic accidents, but also safe in terms of acceptance in the society where women can exercise. It's very, very few places. So again, these are policy decisions that need to be based on evidence, that need to emerge as governments decide, and partners, how to invest their money in African countries. Because we would be trying to avoid to see the emergence of this epidemic of chronic diseases, which is already a reality, simply because the national health systems in the African region are not yet adapted to treating these chronic diseases. So how can we learn from the work that some of you are supporting in dealing with communicable diseases to help countries to adapt their healthcare system so that people who need chronic care can be able to find affordable, available chronic care services where they are living. It was very notable that not only are women affected disproportionately by diseases related to a sexual and reproductive role, but in fact, even in outbreaks, and I'm just giving the example of Ebola outbreaks, a succession of them through the years, women, because of their caregiving role at the home, are the first to be exposed to Ebola. And we see here that the number of women who died compared to men in the Ebola outbreaks has been more. This we can understand intuitively. At home, it's women who are providing care. In the hospitals and the clinics, it's women who are providing care. And when it comes to those rituals and rites of preparing bodies for burial, it's very much women who are involved and concerned, including younger women. So in the interventions and the risk communication that we are collectively engaged in, we need to be aware of these gender differences. And my observation is that we provide very gender-blind, you are at risk type information to people, and who provides this information is also important for it to be receptive to women and to protect the right people. I did notice in the Ebola outbreak in West Africa that, of course, we were saddened and struck by the loss of many healthcare workers, but it's mainly when doctors died that we heard about it internationally. Many nurses died in that outbreak. Many women of different ages were affected and lost their lives. I didn't see this a very prominent aspect of the communication about that Ebola outbreak, but it is a fact that women play a key role in providing care and can also play a very important role even at the community level in supporting surveillance, in supporting the first alerts that something unusual is happening in terms of a disease pattern, because they are at home and they are the ones who are observing what's going on in disease patterns. I won't go into this in a lot of detail, but not only in humanitarian crises where we have population displacement, conflict, is the provision of routine health services, including reproductive, maternal health services, jeopardized in countries. But in the Ebola outbreak as well, in West Africa, we saw that the fear of being infected, of providing services to women in that context of a lack of infection and prevention amenities in clinical services meant that many women were not attended to as they should have done, and we had maternal deaths increasing in ways that were not to be expected. So we have many drivers of women's health or women's ill health in the African region, as we do in the world. Some economic factors, we know that women are poorer in general than men because of many factors, including education, access to jobs, and we also know that even when women and men are doing the same work, not only in African countries, the remuneration can be very different. I've seen dramatic stories of the difference in pay between men and women who work in the BBC in the UK, which surprised me a great deal. In my own history, I happen to be the child of two medical doctors who were working many years ago in the Botswana public health system. And my mother earned less money than my father for doing the same work, and carried out a little campaign in the House and in the Ministry of Health to receive a fair salary for the work she was doing. It took quite a few years for that to be rectified, and I remember my dad being a bit embarrassed, a bit shamefaced, but he wasn't the decision maker at that time. But there was a real injustice in paying the first. My mom was the first African woman to work in the Botswana public health system. I think the authorities simply didn't know where to place her, but it certainly didn't occur to them to place her at the same salary level as her husband, who was a doctor in the same system. So these are some of the factors that drive that area of vulnerability among women. Another issue is to do with the national health financing policies in countries which provide or don't yet really provide health insurance for people, and then women's ability to contribute to their own health insurance so that they don't have to pay out of pocket when they have to use health services, which is a huge cause of people not going to health facilities or families being impoverished, and this is particularly severe as it affects women. Geographic factors, I think everybody is aware that in rural areas, access to health service is very much more limited, and women sometimes have to walk hugely long distances, including for seeking care for their reproductive health problems, and even for going to deliver babies. So geographic factors are important, but not only rural-urban divide. We found that people living in low-income urban areas, in the urban slums, are also at a great disadvantage. We're able to show the Minister of Health of Côte d'Ivoire, for example, that Abidjan has a maternal mortality rate which is way higher than the neighboring countries, Burkina Faso, those poorer countries. And this enabled us to convince her to provide primary care services within the city that will enable women to be safely delivered by a midwife instead of having to queue at the university hospital where the overcrowding caused the quality of care to be so bad that the number of maternal deaths there was hugely increased. Other factors are to do with the inadequacy of healthcare services more generally in terms of quality, from the gaps in infrastructure, in human resources, in in procurement and supply of medicines. One of the most common problems suffered by people in African countries is the lack of stockhouse in medicines, including medicines for some of the diseases with which you as a community are very much concerned. Malaria medicines run out in very many countries. So the health systems in countries need to be better organized, better resourced in such a way that they deliver for the priority diseases that afflict populations, including women. And then the gender-related inequities, I won't go into detail because I've already mentioned, including some cultural factors that lead to women not being educated, not having their education invested in as it should be, including young girls being married off early, female genital mutilation, and a whole lot of other cultural factors, including women's ability to decide that they are ill, they are going to go to the clinic and the hospital, they're going to take their children for care. Universal health coverage is something that is very topical at the moment. As I said, I just came away from a conference where the strategies to address this were being discussed in a lot of detail. Our Director General, Dr. Tedros, was instructed, really, politely, by 3 heads of state to develop an action plan for the 3rd Sustainable Development Goal, working together with other partners. And this action plan was just launched in the World Health Summit in Berlin the week before last, and then also in Astana last week. And the idea here is for people to have access to the essential services that they need. And we observe that this is a challenge as far as women are concerned because of the factors that have already been mentioned, being empowered, being able to take decisions to go and access healthcare. Secondly, that the financing needs to be developed in such a way that there are national, first of all, there is additional domestic investment in health in countries broadly, which will deliver for women's health as well as for health more broadly for the population without people undergoing financial difficulties in paying directly without any insurance schemes being put in place. And I'm very encouraged to see that some countries and some policymakers are taking action to develop these prepayment pooling health insurance schemes starting at the community level in countries like Rwanda, which has managed to pretty well eliminate inequities between households at different income levels in accessing a basic package of healthcare services to others that are being carried out at the more central level, places like Ghana, Gabon, where attempts are being made to provide prepayment and subsidize the needs of lower income households so that people don't have to pay directly out of pocket to access basic healthcare services. There's some very interesting examples in Nigeria of private sector investors working with low-income households and non-governmental organizations to help low-income people to contribute to their own health insurance schemes in ways that enable them to have better access to basic health care, more than would be provided in the public system in government health facilities. One of the drivers of the changes that we need to see for women is women themselves being able to be involved in decision-making, being in leadership positions. So not to flatter myself, but I'm showing you this picture of the First Lady of Rwanda. We organized a couple of years ago an African Health Summit in Kigali, and here we had a session with the First Lady of Rwanda and the Minister of Health of Rwanda. That's the lady in the orange dress, and I have the privilege to be sandwiched between these two people as we were talking about the health of adolescents and particularly of adolescent women. Because what we observe is that women's empowerment needs to be translated through education, through women being given the space to make decisions in the home, and women being in decision-making positions, in policy-making positions in the public as well as the private sector. We see here a slide looking at the gender development index and showing the gender development index, which is based on education status, access to resources, and decision-making space and authority for women, and how our region still lags behind in comparison with the global average and other regions. And this index simply shows what is the reality of women being able to make decisions and influence the outcome in terms of health for themselves particularly and for their families. We note that there are still gaps to go, but as I'll show you in a minute, we are very encouraged by some of the progress that's starting to show up. So just to take an example, if women are empowered in terms of differences in education, in terms of income, and in terms of their position in marital relationships, we see how women are better able to have access to a skilled birth attendant in order to have a safe delivery. So it matters. It matters a great deal, and it's something that compels us to want to pay better attention to, for example, education as part of our striving to improve women's health. So it's not something that has not to do with the direct action of the health sector, but which deserves our advocacy in order for governments to invest more in the education of women for us to see better health outcomes. We are starting to see improvements in women in leadership in the region, as I said, in the political space. And it matters a lot whether we have women parliamentarians and women ministers, because they do influence the policies of governments, whether we have women leaders in the private sector, in private companies, who are able to make certain decisions, and what is the situation of women leadership in global health. So I was very excited to be approached by a movement that's going on in improving women's representation in global health, particularly in decision-making positions in global health. And we as WHO are partnering with this group to see how to mobilize women's involvement in the African region in global health, and networking, identifying women where they are scattered in countries, in institutions, including African women working in organizations abroad, to work together as a group and to advocate for the improvement of women's status as it relates to health, to their own health, and to their contribution to global health. I think that this is a movement that's going to have a huge impact. We are working with them now to mobilize and identify women in Francophone countries who are involved in global health. And the connecting of women at key events, in my view, is going to be a powerful incentive for us to work together and influence in different spheres the decisions that get made, so that we address the inequities and are able to unleash women's potential for health. So in the context of universal health coverage, working on the Sustainable Development Goals, what is it that we need to be paying attention to in some of the strong directions in which this work is going? First, I won't say it again, we need to improve the rewards, the recognition of women's contribution to providing care in health, and also to improve their leadership positioning in this, not only as caregivers at home or in primary care clinics, but as leaders in public health, leaders in clinical health, and leaders in some of the organizations that influence policies in global health. In addition to that, we need to pay attention to rewarding and do the advocacy and find the strategies that enable women to be rewarded for the work that they do providing care in families, and the opportunities that they miss to be involved in other outside activities, including in earning an income. This is a problem, as I said, globally, not only in African countries. We also are very excited at some of the opportunities offered by research and development, the work that many of you are doing here, and innovation in contributing to global health. And I would like to urge that we make space for women to play their role here as well, women to be engaged in and contribute to research. I'm very excited when I go to some of these conferences and find young women researchers having opportunities provided for them, being funded to, first of all, be trained, grow their skills. There's a program called the EDCTP, the European Developing Countries Partnership on Research and Development, which has a very strong emphasis on supporting and training women researchers and unleashing that potential that they bring. For example, in innovation, which is something that many of you in the society are involved in, we are also keen for women to be given the space and the opportunities to play their part. We see that technology is playing a very strong role now in contributing to universal health coverage, to progress in health. And I'm hoping that, again, here, women will be provided with the opportunities to make their contribution and take part as not only recipients of the benefit of technology, but innovators, people who provide brilliant ideas on how to innovate and improve access to healthcare. I believe that all of this, paying the real attention that, 40 years of discussion on gender equity have simply not been able to deliver. I believe that in the work that we are going to be doing on the social determinants, while we look at different income quintiles in a gender-blind way, we could benefit a lot by focusing particularly on women. They're a huge force for change. They are engaged in providing healthcare already, in leading in ideas and investment in a particular way and targeting, I believe, will make us reach universal health coverage all that bit faster than we are progressing at the moment. Thank you. And for that, I look forward very much to encountering, working through the leadership of the society, how we as WHO, in the reforms that we've tried to put in place, can interface with you in the influence that we have on decisions in countries, on policy, strategy, service delivery, how to harness the good work that you are doing and make sure that they translate into services for people. Because if that doesn't happen, it's going to be very difficult for them to make a difference in people's health. Thank you very much.
Thank you. Thank you, Dr. Moeti. That was insightful and inspirational kickoff to the meeting, and challenging some of our assumptions and the way that things have worked in the past. So we have something for you. Hope that it will remind you of the words that you spoke to us today, but also the opportunities we had to listen to you. And so thank you very much. Thank you very much. Okay. So if Dr. Moeti's keynote is any indication, this will be an informative and inspiring annual meeting. And so on to the next part of our agenda, which is the awards program. First, we recognize this year's ASTMH Travel Award recipients. For some of our young scientists, a travel award from ASTMH presents them with a once-in-a-lifetime opportunity to attend this conference, to meet with some of the real giants in our field, and to connect with friends and make new connections. I was able to attend the students' reception this afternoon. We could barely get them to talk to us. They were having a great time talking to each other. Thank you very much. With support from the Bill and Melinda Gates Foundation, we have awarded 44 travel awards this year. And if you receive one of these awards, please stand and be recognized. I know you're out there. I do want to thank the Society and its members and to the Foundation for their continued support of this important program. Next, we want to recognize the recipients of the Burroughs Wellcome Fund ASTMH Postdoctoral Fellowship in Tropical Infectious Diseases For 19 years now, this fellowship has supported the career development of physician scientists focused on infectious diseases of the developing world. Well done to this year's recipients. And I do want to recognize that the institutions in the program were accidentally switched, and so it gave them a little bit of an identity crisis, just for clarity. Lisa Babel is from Massachusetts General Hospital. Deanna Friedman-Klabanoff is from the University of Maryland, and Peyton Wilson of the University of North Carolina. Please stand to be recognized by your colleagues. Now to the results of the Young Investigator Awards. The judging was held only today. Each year in the afternoon before this opening plenary, Young Investigator Award applicants present the results of their research to our panel of judges. If your name is called, please stand to be recognized. Our 2018 Young Investigator Award recipients are, first the winners, Christina Faust from the University of Glasgow. There she is. Cordelia Coulthard from University College London. Erin McDonald from the Centers for Disease Control. Catherine Mitran from the University of Alberta. And Ethan Degner from Cornell University. There were 6 first-tier mentions. Julie Mwasigwa from University Medical Research Council Unit at Gambia at London School of Hygiene and Tropical Medicine. Ian Buller from Emory University. Karthikeyan Gunalan from the National Institutes of Health. Pedro Gazinelli Guimares from the National Institutes of Health. And Olivia Winokor from University of California, Davis. They didn't tell me how to say all these names, so I apologize, because you were just named hours ago, so we're learning these together. And we have some honorable mentions. Johann Mischlinger from Bernard Nock Institute for Tropical Medicine and University Medical Center. I'm hoping you're standing and that you're here. Lucia Valsky from the Bernard Nock Institute for Tropical Medicine and University Medical Center. Sonia Agrawal from University of Maryland School of Medicine. Megan Vogt from Baylor College of Medicine. And last but not least, Niraja Suresh from the University of Notre Dame. We will also post these results in the registration area, so if you see any of these young investigators during the meeting, please congratulate them. We know they've worked very hard. I also want to thank Dr. Annie Petrie and the late William A. Petrie Sr., Tech Lab, the Petrie family, PLOS Neglected Tropical Disease, Michael Gottlieb, and Thomas C. Green, Joel Moss, for their very special commitment and continuing support for this important program. It is really essential that we recognize and support our young people who are doing such excellent work. Congratulations to all of you. Judging was also held today for the Elsevier Clinical Research Award, and if your name is called, please stand to be recognized. The recipients for this year are the first place, Nima Briggs from University of Texas, Houston, Texas. Hope you're here. Jonathan Chang from Duke University School of Medicine, Durham, North Carolina. And the third is Thomas Siegert from University of Washington, Seattle, Washington. Thank you to Elsevier for its support of this award and to the judges who volunteered their time, a really important aspect of making all of this happen. And congratulations to our deserving recipients. As a society, we are fortunate to be able to offer a number of awards and fellowships throughout the year, and this is due to long-standing and excellent financial stewardship by ASTMH's leaders. You can see all of these awards and list of awardees in the program book and meeting app. And thanks to all of our committee chairs and committee members who volunteered their time to work on these programs and make these opportunities possible. We rely on you for this work, and we're really grateful for it. And there are a number of both travels, advanced training, and student awards that come from the various groups, ACME, Global Health, the Robert E. Shope, et cetera. I'm not going to read them all. Now, the Society would like to recognize the 2018 Fellows of ASTMH. And I was really surprised when I read this. Oh, you'll see why. As I was preparing for this, we recognize these members for their sustained professional accomplishments in tropical medicine and related fields. This is a high bar set by the Society, and Fellows of ASTMH recognition is available only to members of the Society. And so I was honored to be named an ASTMH Fellow myself this year, but I congratulate the others whose names also appear on this list. And will each fellow please stand as I read your name? Please hold your applause till the end. James Diaz, Eva Harris, Charles King, and then myself. So thank you for all your hard work and commitment to the tropical medicine community. Each year, we also recognize international leaders in tropical medicine field through the special recognition that is called the Honorary International Fellows of ASTMH. These honorees are recognized for the eminent contributions to a particular aspect of tropical medicine and/or hygiene. We have 5 honorees this year, and when I announce your name, please stand and be recognized by your colleagues. And these are going to go in alphabetical order. Our first honorary international fellow is Nicholas Anstey. Because of time constraints, I'll give you just a couple of brief highlights about the scientific careers that we are about to honor. Nicholas Anstey is the first author of a very important paper in the Journal of Experimental Medicine. He demonstrated that nitric oxide was not a toxin in falciparum malaria in children, but that it was actually protective against the development of severe malaria. Dr. Anstey continues to work with nitric oxide and host resistance to malaria, as well as research in Plasmodium knowlesi. Well done, Dr. Anstey. Congratulations. Our next honoree is Zulfikar Solfi-Bhutta, who I was delighted to see that he had actually come, and we spoke about the need for more work in this area. He is one of the most highly recognized experts in global child health and survival. He has made seminal contributions from his base at the Aga Khan University in Pakistan, where he is a founding director of the Center of Excellence in Women and Child Health. He also holds the Robert Harding Chair in Global Child Health at the Hospital for Sick Children, Toronto, Canada, somehow magically splitting his time between these two institutions. Many of us also remember his outstanding commemorative fund lecture at the 2016 annual meeting in Atlanta. Congratulations, Professor Bhutta. Please stand to be recognized. Our next honoree is Pedro da Costa Vasconcelos. Dr. da Costa Vasconcelos is an internationally known and respected physician and virologist who has made major contributions to knowledge about the epidemiology and control of arthropod-borne viral diseases in Brazil. His special interest and expertise has been yellow fever and viral hemorrhagic fevers, but he and his laboratory have also been involved in field and laboratory investigation of a variety of other arboviral infections, including dengue, Zika, chikungunya, and Mayaro fevers in Brazil. Congratulations, Dr. da Costa Vasconcelos, who is here with his family. Our next honoree is Rose McGrady. Professor McGrady has spent more than 25 years on the Thailand-Burma border, working mostly with refugees and migrants, documenting over 70,000 pregnancies and maintaining meticulous patient records, As a result, we better understand the detrimental effects of malaria during pregnancy on the fetus and child for both P. falciparum and P. vivax. Furthermore, largely as a result of trials that Rose led, the WHO guidelines have changed to recommend the use of artemisinin during pregnancy. Congratulations, Professor McGrady. And I believe she is not here today, was not able to join us. Our fifth and final honoree is Faiko Turcoyo. Faiko is Professor Faiko. Started his remarkable and highly productive career 30 years ago in Thailand. He worked for CDC before moving to Kenya and the Camry Field Station, where he led one of the world's first large-scale trials on insecticide-treated mosquito nets. After 2 years at the CDC Atlanta at the malaria branch, he was recruited to Liverpool School of Tropical Medicine, where he heads the malaria epidemiology unit. He also currently leads the Global Malaria and Pregnancy Consortium, a network of 40 institutions conducting research on treatment and prevention of malaria in pregnancy. Since 2013, he has lived in Kenya, working as part of the tripartite collaboration between Camry, CDC, and the Liverpool School of Tropical Medicine. And I know he is here. Congratulations, Faiko. All of these years, recipients have contributed to our collective knowledge, and tonight we personally thank you. And now, on to a very special honor that has personal and professional significance for every member of the Society, the Alan J. Magill Fellowship. Created in 2016 by the Society's Council in partnership with the Bill and Melinda Gates Foundation to honor the life, example, and legacy of Alan J. Magill, FASTMH, a widely recognized and respected leader in the globe of tropical medicine community who passed away suddenly in 2015. The Magill Fellowship provides $50,000 in funding for up to 2 years to one recipient. These funds will support mentorship and career and or leadership development projects for one member annually in their early to mid-careers in serving low and middle-income countries with a focus on leadership development in tropical medicine. Much like what Alan did with others, the unique feature of this fellowship is the support of career-broadening experiences to enhance professional development and leadership opportunities beyond those traditionally available within the applicant's home organization, and in so doing, equip awardees to later assume leadership and mentoring roles in various aspects of tropical medicine. Our 2018 Magill Fellow is Dr. Abhilasha Karki, a member from Nepal. Dr. Karki, will you please join me on stage? Here she is. Dr. Karki is a recognized and international authority on typhoid fever in South Asia. She has taken on the challenge of addressing increasing antimicrobial resistance in multi-drug-resistant organisms that are highly prevalent in South Asia, like Salmonella typhi. During her 2-year fellowship, with the mentorship of ASTMH past president Ed Ryan, Dr. Karki will apply for the Harvard School of Public Health course in Healthcare Systems Delivery. We'll love to have you in Boston. And a course in Women Executives in Healthcare. Additional time will be spent with the Red Cross, the International Congress of Infectious Diseases, and the Oxford University Clinical Research Unit, as well as the Wellcome Trust in the UK. On behalf of the Society and all of us who continue to be inspired by Alan, we are pleased to recognize you as a 2018 Magill Fellow, the second of a cohort of 20 over the next 2 decades. Please join me in congratulating Dr. Karki. Our next honor is the Harry Hoogstraal Medal, awarded by the Society's subgroup ACME, the American Committee of Medical Entomology. I hope I said it correctly. The recipient of this year's medal is Thomas Scott, who I haven't seen but I believe is here at the University of California at Davis. Dr. Scott, will you please stand to be recognized? Let me see him. ACME will honor Dr. Scott further during its annual business meeting and awards presentation Tuesday afternoon. Dr. Scott is a distinguished professor of mosquito-transmitted disease ecology and epidemiology at the University of California, Davis. His research has taken place in Southeast Asia, Latin America, the Caribbean, Thailand, and Peru. Congratulations, Dr. Scott. Our next honoree is the Scherer Hardy Award from the Society subgroup ACAV, the American Committee on Arthropod-Borne Viruses. The recipient of this year's award is Nathan Gruba. Dr. Gruba, will you please stand and be recognized? I'm not sure where he is. ACAB will honor Dr. Gruba further during its annual business meeting and awards presentation on Monday. Formerly with the Scripps Institute and now affiliated with the Yale School of Public Health, Nathan Gruba's lab uses genomics to determine the emergence risk and to track the spread of mosquito-borne viruses, including Zika, chikungunya, dengue, and West Nile. Congratulations, Dr. Gruba. Our next honor is the Richard M. Taylor Award, also from ACAV. The recipient of this year's medal is Laura Kramer of the New York State Department of Health and School of Public Health. ACAV will honor Dr. Kramer further during its annual business meeting and awards presentation Monday. She has a long and highly productive scientific career spanning 5 decades, which includes the study of arboviruses, basic studies of virus-host interactions, virus evolutionary biology and ecology, and virus discovery. And I know her because she's also completing a 4-year term this week as an ASTMH council member, and we are really grateful for her leadership during this time. Please stand up and be recognized, Dr. Kramer. Our next honor is the William Traeger Award for Basic Parasitology, awarded by the Society subgroup ACM-CIP, the American Committee of Molecular, Cellular and Immunoparasitology. The recipient of this award is Elizabeth Winsler of the University of California, San Diego. She will be honored tomorrow during its symposium, ACM-CIP symposium session. She was the first to demonstrate that ultra-high throughput phenotypic screens could be used to rapidly discover new antimalarial chemotypes with clinical potential. And she also pioneered phenotypic screening methods to discover genetic variants and has shown how this information can lead to chemically validated drug targets. Please stand up and be recognized and congratulate her. Peter Hotas, if you could join me. Please welcome past President Peter Hotas, co-chair of the Communications Committee. And there you are. And I will stay with him in standing in for Karen, who is not able to join us this afternoon.
Well, thank you, Gina. The Communications Awards is a society-level award recognizing excellence in tropical medicine storytelling through the written word. And as we all recognize today, there is an urgency for accurate reporting of science to a non-science audience, now more than ever, certainly. Communications Awards entries are submitted throughout the year and judged on their ability to enhance the public understanding and appreciation of tropical medicine research, clinical practice, and policy. This year, the Communications Award Committee received 30 eligible entries for our panel of scientists and communications professionals to evaluate. Selecting one standout as a winner was very tough. And I mention this because it bodes well for the tropical medicine community that we have a robust series of articles that we can expect in the future. We need the news media to tell our stories and be our third-party advocates, and to this with quality articles and accurate science. Before we announce this year's winning submission, we want to acknowledge 2 articles that the Communication Awards Committee elected to award with honorable mention. The first one was Nipah virus, An Anatomy of an Outbreak by Priyanka Pula, which appeared in the Hindu on June 2nd this year. Priyanka did an outstanding job reporting how Kerala State handled the Nipah virus earlier this year and how it holds crucial lessons for the rest of India. The second honorable mention was awarded to Mark Johnson of the Milwaukee Journal Sentinel for his article, The Hunt for a Future Killer. Mark reported on zoonotic diseases and the ongoing efforts of one research team to track those viruses in rural Uganda. I'm pleased to announce that this year's winning entry for the 2018 Communications Award is entitled Chasing a Killer. It appeared in the Washington Post on November 3rd, 2017. Written by national reporter Lena Sun with photos by Mulina Mara. The article reports on efforts by scientists from the CDC and the Congo Republic to track the origins of monkeypox virus. Lena and Molina were given a rare invitation by the Centers for Disease Control to accompany its scientists to the village of Moeti in the Congo, a 6-hour boat trip from the nearest airport. The resulting article was reported and beautifully photographed from the ground, offering readers an effective glimpse into the world of virus hunters. I should also like to add as a personal note that Lena's been an extraordinary champion of vaccines and the science of infectious diseases. She's been an incredible journalist and advocate for our society. Lena, please join us on stage.
Thank you very much for this honor. It's my privilege to do this job because I think it's one of the most interesting things I've done in my journalism career. I'm one of the reporters on the national staff at the Washington Post. I cover health. I'm based in Washington, but the last few years the focus has been on a lot of these infectious disease outbreaks, as you all know, Ebola in West Africa, Zika in Brazil. And I think it's important for Americans to understand that the work that you all do behind the scenes, not just when outbreaks happen, but all the work that goes into trying to understand and prevent them. And I had always wanted to do that with the CDC. I got the chance to go with them to Congo Republic, the 6-hour boat ride up, 9-hour back in the dugout canoe. And lots of interesting discussions about what we would do for the bathroom break. So we went to this remote village, and I think it was a chance to have explained to Americans the behind-the-scenes work that the scientists do that you all know so well. And they were trapping and sampling a variety of animals to try to find evidence of monkeypox, of a virus in the animals. And just the sheer logistics of going and bringing all the supplies from Atlanta, including a 48-ounce jar of Jif creamy peanut butter to make the bait for the traps. The sheer unpredictability of working in the field, not knowing when the workers were going to show up, or with the motor of the boat breaking down, or arriving in the village and the village chief not knowing that we were showing up and where were we going to pitch the tents that night. The patience, the determination, the ability to stay calm in all sorts of circumstances. It was so inspiring to see, and I think it's really important for the work that you do, not just to write about it in the journals that are peer-reviewed and that are read by the very few, but to share that information as much as possible at a time when there's such an attack on science and on facts. And in order to do that, you have to be able to explain what you do in plain English. And it is very important, and I think so many scientists do such wonderful work, but it's just as important for you to explain that and communicate that to the broader audience. It's difficult, but it's important. Thank you very much.
That's great. Thank you, Peter. So now we move on to the Bailey K. Ashford Medal, which honors distinguished work in tropical medicine. And this year, we have 2 Ashford Medal recipients. The first Ashford Medal, will Barbara Sorkin please come to the stage to present to Wendy Prudhomme O'Meara.
Good evening. I'm delighted to have the joy and honor of presenting this medal to Wendy this evening. I first met her when she came to the Fogarty Center at the NIH to do her postdoc with my late husband, Ellis Mackenzie. There's some parallels between their journeys to malaria research. Neither of them started out that way. Ellis was doing ecology research in Papua New Guinea when he fell in love with the intellectual challenges and potential to do good that mathematical modeling of malaria offered. Wendy shares Ellis's passion for intellectual challenges and the search for truth in the service of improving lives. She learned, as all of us who worked with Ellis did, to question what we think we know, that the original data often don't say what we've been taught they do, and that going back to those source data can be critical for the science to advance. Wendy's path, like Ellis's, changed after her first research trip abroad. She fell in love with Kenya, where appropriately for an Ashford Medal awardee, she's lived and worked pretty much ever since. That first trip exemplified her ability to nimbly acquire whatever expertise is needed for the task at hand, as she jumped in to help teach the course that she'd gone there to collect data from. That focus on malaria research was already a long way from Wendy's UC Berkeley degree in biochemistry and her MIT PhD in chemical engineering. Her research now ranges through slowing the development of resistance to antimalarials, improving the understanding and control of malaria transmission, and understanding non-malaria fevers. For her research, she has learned to do clinical trials, as well as to apply cutting-edge plasmodium genetics and spatial technologies. One of the ways that Wendy is continuing Ellis's legacy is through her suggestion that his collection of early 20th century works on malaria be made available to the research community at large. I'm pleased to tell you that Ross's studies on malaria is among the first of those books to be coming online through NIH's National Library of Medicine's Locator Plus database. Wendy is carrying on Ellis's joy in mentoring. Like him, she leavens the passion for truth-seeking with humor. I'm pleased to present this year's Ashford Medal with great pleasure to a superb scholar, researcher, mentor, and heir to Ellis, who I'm grateful to call a friend.
Second Ashford Medal is recipient this year is Tyler Sharp, and will Joe Vanetz please come to the stage to present Dr. Sharp.
I'm very glad to be here, and I'm really honored to be able to present Tyler for the Bailey K. Ashford Award. It's super appropriate. He's been living in Puerto Rico as a CDC employee, first as an EIS officer and rising through the ranks, and this is where Bailey Ashford really did his work on hookworm anemia. And so Bailey Ashford really has had a tremendous public health impact and legacy for many years. And so Puerto Rico is going to be honoring Tyler for his contributions. Tyler is currently has, it's those three stripy things on his jacket. He's a officer in the Public Health Service. He'll tell you what it is. But he's risen through the ranks. Can I have the next? Let's see yeah. Okay. So he has an outstanding pedigree. He was born in Ohio and got lost and ended up in Canada at a fine university where he got his bachelor's degree. Then he went on to do graduate work in Bozeman, Montana. Did his PhD, he got lost even further in Texas. Ended up at Baylor with Mary Kay Estes doing norovirus virology. And then joined the CDC in 2010, where he joined the CDC dengue branch. He's been there ever since. He was seconded in 2014, and I'll show that in just a moment, but he's been focused on arboviral diseases and epidemiology in really all aspects. And currently he also holds an adjunct position at the Yale School of Public Health. You have the next slide. Just in the last couple of years, Tyler has led major contributions to understanding the natural history of Zika virus. In 2014, he was in Fiji, where there was an outbreak of Guillain-Barré syndrome, and he learned a lot from this outbreak because he applied it to the Zika outbreak, where we learned a lot about some of the neurological, devastating neurological effects of Zika. He also has worked on other diseases, including leptospirosis, endemicity in Puerto Rico, melioidosis, and the epidemiology of chikungunya and dengue, in not just the Caribbean area, but also in the South Pacific. He's a young lad. I can't even say the Bailey Ashford Award is supposed to be for mid-career, and he's so distinguished he is mid-career, but he's young mid-career, and I expect really outstanding things from him. Next slide, please. This is a slide of him in Fiji among an affected Melanesian community with Guillain-Barré syndrome, and these are the lessons learned that he applied in Puerto Rico. And then last slide, his family, he's a newlywed. We should congratulate him in a moment. You can see him with his wife Carla and with many other of the Sharp family. They're not here tonight with him except for in this photograph. But congratulations, Tyler, for this very well-deserved award.
Very quickly, I'd like to thank the Society, and very importantly, I don't see this as an award for me as an individual, but much more so for all the individuals working at CDC Dengue Branch, from the janitorial staff to the branch chief, everybody in between. Thank you very much.
Thank you, Dr. Venetz, and congratulations, Dr. Sharp. Our next award is the Joseph Augustin Le Prince Medal. It's awarded in recognition of outstanding work in the field of malariology. Will Chandy John please come to the stage to present the Prince Medal to Miriam Laffer?
Some things just make you very happy, and it makes me very happy to present the Joseph Augustin Le Prince 2018 medal to Dr. Miriam Laffer. The Le Prince Medal is given once every 3 years for work in the field of malariology, and the list of awardees is the who's who of malaria research, and Dr. Laffer joins this list because of her distinguished work in malaria epidemiology. If I can have the next slide, please. So Dr. Laffer did her pediatric ID fellowship with Dr. Chris Plow at the University of Maryland, where she's remained and is now professor of pediatrics, as well as director of the Division of Malaria Research at the Institute for Global Health there. A particular highlight of Dr. Laffer's research in malaria epidemiology is her discovery of the return of chloroquine susceptibility in Malawi, which she published, as you'll see in that top thing, the top figure, as in the New England Journal of Medicine, a landmark article that to date has received almost 400 citations. She subsequently showed in another highly cited paper that the return of chloroquine-susceptible malaria in Malawi was a re-expansion of diverse susceptible parasites. And then this year, the study that you'll see in the lowest corner was her study in the Lancet Infectious Diseases that showed that chloroquine prophylaxis, or IPT, was not more effective than SP-IPT in preventing malaria in pregnancy, despite the very high rate of SP resistance. If I can have the next slide, please. In other areas, she's done outstanding work characterizing clinical malaria in individuals with HIV, as well as studying the immunology of malaria in pregnancy, and her studies have really changed our understanding of malaria epidemiology. Miriam is also, as you will see, a mentor to many trainees, US, Malian, and Malawian, and she has a life beyond research that she celebrates with her husband Patrick and her 3 boys. As I've watched Miriam move from fellow to junior faculty member to senior faculty member and leader, I have marveled at her intelligence, her focus, her dedication, and her ability to just get things done. Most of all, I admire her ability to remain warm, caring, and nurturing, but at the same time tough as nails in her pursuit of excellence in research. Fortunately for us, Miriam has many, many years of great malaria research before her, and I can't wait to see what else we're going to learn from her. In the meantime, please join me in congratulating Dr. Miriam Laufer as the 2018 recipient of the LaPrince Medal.
So much. This is such an honor, and you know, no one goes into this business expecting lots of praise and recognition, but when you get it, I just want everyone to know I feel very grateful and honored. Mostly, I'm so grateful every day that I found this career that I find so meaningful and fulfilling. Every day, my colleagues and I wake up in the morning and decide what we are going to do to try to save lives, and we just go ahead and do it. It's been a great career, and I look forward to how it will progress. And for those of you that know me, know that my true passion is training and mentorship. And I want to give a special thank you to my trainees, former and current, the people that I mentor who work directly with me, the people who hang around our group and get trained by my colleagues. It's been a wonderful experience learning for myself what it means to be a mentor, and it's been a pleasure to work with every single one of you. Thanks to you who are my family at work. Thanks to you for the dedication and patience of my real family at home, and thank you very much to the Society for this recognition.
Last but not least is our final award, the Clara Sothmey-Ludlow Medal, was created by the Society in 2017 and awarded for the first time during last year's annual meeting in Baltimore. It's the first Society-level medal to be named after a female icon in tropical medicine. It recognizes both male and female honorees for their inspirational and pioneering spirit, whose work represents success despite obstacles and advances the field of tropical medicine. Will Barney Klein please come to the stage to present the Clara Ludlow Medal to Najeri Wame?
What a joy it is to present this prestigious medal to Professor Jerry Wame. Jerry's pioneering spirit as a Kenyan woman was ignited by a high school term paper on river blindness. She became driven to contribute to the knowledge and control of this disease. Jerry was the first in her family to leave Kenya for higher education. Her keen mind, her boundless energy and tenacity led her through undergraduate and graduate studies that culminated in 1995 with a PhD degree in parasitology from Tulane. Her academic lineage flows from distinguished parasitologists, many of whom were mentored by an honored name in our society, Professor Paul Beaver. Professors Tom Oriel and Patrick Lammy co-chaired Jerry's dissertation committee. I served as departmental chair in that era. One is immensely impressed with what this remarkable woman has accomplished since completing her doctoral studies. And time permits only a very shallow inspection. First slide, and I encourage you to read it, please, because of the time limitations. Describes some of her current activities. She is currently serves as Dean of the School of Pharmacy and Health Sciences in Nairobi. This position presents her with new academic and managerial challenges, but she remains deeply involved in research and advisory capacities. Jerry has 3 children and a pair of 9-year-old grandchildren, and I know that her work keeps her away from these grandchildren far more than she would like. The next slide shares with you what colleagues and peers have to say about her. Some pretty wonderful comments. I'll finish by sharing with you the recognition that Professor Wami received 3 months ago in Kenya, that nation's Nelson Mandela Award. I've borrowed a few words from the chair of the board that selected her. And the final slide cited her commitment to research, integrity, productivity, and sincere passion for everything that is good about Africa. Professor Wami, please come forward and become the 2nd recipient of the Clara Ludlow Medal.
Good afternoon, everyone. It's very difficult to stand in front of all of you because even as I receive this award, I know truly that I'm not the most deserving person. There are many, many other people who would have received this award today. The difference is that I took the chance to work in an area that has been very difficult, and without the populations that I have been working with in Kenya, both for my field work and in the laboratories, I would not be standing here today. I think that's the only difference. Plus, of course, being a member of the American Society of Tropical Medicine, which I would not be if there was no such a society. So I'm really running out of words to express my deep appreciation for being recognized here for this award. And I can't overemphasize the importance of giving women a chance. I want to underscore what our director at the World Health Organization in the African region, Dr. Moeti, just shared with us in her keynote address, that women matter, and in most cases, women are always left behind. Had my parents, and I happen to be the 5th born of 14 children of one father and one mother, had my parents not recognized that it's important to educate the girl child, I would not be here today, and I really accept this award on behalf of them, or it's actually not just mine, but for them and all those people who have supported me along the way during my training and the populations that I have worked with in the field. Thank you.
No, it's been a long evening, and very soon there will be a jazz group that's going to lead us over to the next step. But I want to recognize that people in this society aren't doing this for money, right? And you're actually not doing it for recognition. You're doing it for love of science, for love of the people that you work with. And it's, you know, once a year we get to take a little time to recognize not only the effort that you put in, if you're a young scientist, but also the results of that after a career of working so hard. So it's been a wonderful evening. Thank you all for celebrating the successes and advances that our colleagues have made in careers, not only lifetime achievements, but careers in early stages. It's been a pleasure, unique for me to host tonight's event, and I hope that you're as inspired and humbled as I am. And what a great way to start 3.5 days of scientific discourse. This concludes our opening session. Please join us in our wonderful 2018 exhibitors at the opening reception in the exhibit hall across the street at 7 p.m., which was 25 minutes ago. On the third, but honestly, it says that we're 2 minutes early, so I'm confused. But it's on the third floor of the Sheraton in the Napoleon Ballroom. And as Dan explained in his introduction, just look for the jazz band that's going to lead you over to the Sheraton safely with the help of our local policemen, and enjoy your time here in New Orleans during annual meeting. And I recognize that it is Halloween on Wednesday night. So I look forward to seeing what you come up with. Have fun, everybody.